Okay, so hello and welcome to our Zoom education session today on visual and perceptual changes in the brain. So thank you for joining us today for this discussion. Our presentation today is all about understanding visual and perceptual changes that can happen when a person has dementia. As dementia continues to progress, sensory and perceptual abilities can be affected, as well as peripheral vision, depth perception, and color perception as well. So this presentation addresses how these changes can impact the person living with dementia's abilities to safely and effectively navigate their environment. And we also provide some strategies to address and adapt to these visual and perceptual changes as well. So my name is Shelby Berry, and with me today is Chris Van Leuven, and we are both education coordinators here at the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. So we recognize that during our discussion today, there may be several questions that come up for you. And just in the interest of time, and because I'm not always able to see, the chat pod when presenting, we're going to ask that we just hold questions until the end of the presentation. If you do have a question that does come up, feel free to write that in the chat pod, so that we can look at that at the end and capture that question. And then we will also have some time at the end of the presentation to address those questions as well. So let's get started with today's content. So let's start off our discussion today by talking about vision difficulties that may occur when throughout a person's life due to changes in their eye health in general that may come with age. So the process of aging is acknowledged for the many changes it can bring. And one of these significant changes can involve our sight and perception. With age, we may experience a range of vision changes, including the blurring of images or not being able to see things as sharply as before, the need for more time to adapt to changes in light levels. So when going from a dark room into the sunlight or the daylight, for example, the area in which objects are seen could be getting smaller, and this is known as our visual field decreasing. We may experience a loss of peripheral vision. So this has to do with our ability to see things outside of our direct line of vision. We also may experience problems with depth perception with aging. So this is our ability to judge the distance of or to an object and to see things in 3 dimensions. And finally, shadowing from small shapes floating in our visual field, which is commonly known as floaters, may be something that is experienced. So it is important to know that any one of these changes can be experienced by someone who is aging. And indeed, many of these changes may be experienced as a person continues to age as well. The most common eye conditions that can impact our vision and perception as we age are listed here. So we have cataracts, glaucoma, macular degeneration, retinal complications from diabetes, and Charles Bonnet syndrome. So these conditions can all result in changes such as blurring, distortion, partial loss of our visual field, and in some cases, blindness. So a cataract is a clouding of the normally clear lens of your eye. So for people who have cataracts, seeing through cloudy lenses is a bit like looking through a frosty or a fogged up window. Glaucoma is a group of eye conditions that damage the optic nerve. the health of which is vital for good vision. This damage is often caused by abnormally high pressure in your eye, and glaucoma is actually one of the leading causes of blindness for people over the age of 60. Macular degeneration is a degenerative condition affecting the central part of the retina or the macula, and it can result in distortion or a loss of that central vision. It occurs especially in older adults, in which case it is called age-related macular degeneration. Retinal complications from diabetes can also occur. So the most common complication is diabetic retinopathy, and it is caused by damage to the blood vessels of the light-sensitive tissue at the back of the eye, which is the retina. And these conditions can also cause hallucinations to occur. And this particular condition is known as Charles-Bonnet syndrome. So Charles-Bonnet syndrome occurs when people whose vision has been compromised may start to see things that aren't there. So they may experience visual hallucinations. And there are two main types of hallucinations here. They might see simple repeated patterns, or they might see complex images such as people, landscapes, or objects. And these hallucinations are caused by the person's deteriorating sight and not from any other condition. So we're going to take a look here at what someone may experience visually from some of these conditions, because some people living with dementia may experience some of these, eye conditions in addition to some of the visual perceptual changes related to dementia, which we're going to start talking about in a moment. So this slide depicts how vision can change when a person has cataracts. So on the left, you can see the image of the man with the boy sitting on the dock with normal vision. And in the picture on the right, the image is blurred due to the presence of cataracts on the eye. So again, that blurriness or that fogginess that we talked about. This slide demonstrates how vision change can change when a person has glaucoma. So on the left, you can see the picture of the two people in the kayaks through normal vision. In the right, the outer edges of the image cannot be seen due to the presence of glaucoma. So again, a comparison of what those conditions might look like. And then this slide shows how vision can change when a person has macular degeneration. So in the left image, you can see the image of the two dogs running through a field through normal vision. In the picture on the right, the image of the dogs is almost completely hidden due to the presence of macular degeneration. So with macular degeneration, a person's central vision can become lost or distorted. So they may have a hard time seeing anything that is in that central vision. And it's important to acknowledge that there are other conditions that may cause vision problems to occur as well. So for example, a stroke can also cause someone to have difficulties with their vision. They may lose the ability to see things directly ahead, which is also known as our central vision loss, or they may lose peripheral vision, which is also known as a visual field loss. And this can happen in both eyes at the same time. The person may also experience problems with eye movement and how the brain processes visual signals. Certain medications can also cause or contribute to problems with vision. They can include drugs for cardiovascular problems, non-steroidal anti-inflammatory drugs, antibiotics, drugs for Parkinson's disease, and other eye medications as well. And then here we see the specific types of dementia and how they can also damage the visual system and cause visual and perceptual difficulties. So these include diseases like Alzheimer's disease, Parkinson's disease dementia, Lewy body dementia, and vascular dementia. Rarer forms of dementia, such as posterior cortical atrophy, or also known as PCA, can also cause visual and perceptual difficulties as well. And if you haven't heard of posterior cortical atrophy before, it is a rare progressive neurodegenerative disorder, and it is a variant of Alzheimer's disease that causes damage and deterioration to the back or posterior region of the brain. So that area of the brain is responsible for processing what and how we see. So posterior cortical atrophy may affect a person's vision, their ability to read and write, their ability to fill out forms, as well as their ability to navigate and to reach for objects. It can also cause blurred vision and problems with depth perception. So symptoms of posterior cortical atrophy are most commonly seen in people in their 50s and 60s, but can affect people until their 80s as well. So if you have any more questions specifically about posterior cortical atrophy, please feel free to reach out to us and we can find you some helpful resources on that topic as well.
Hey, so I'm going to jump in here and let's take just a few moments to talk about some of the brain changes that can occur in dementia. So as we've discussed in our other education sessions, when a person is experiencing a disease like Alzheimer's disease or another form of dementia like vascular dementia or Lewy body dementia, the brain can experience really a tremendous amount of change. And depending on the type of dementia and the areas of the brain that are being directly or indirectly impacted by how that condition is progressing, it can cause changes in the person's cognition, in their memory, in their day-to-day abilities, their communication, their reasoning, and their insight. Really, that list of changes goes on and on. And we might not always think about how the damage to the brain also interferes with the other ways that we experience our world, such as our physical abilities and our perceptual abilities. The ability to see and experience our world is a complicated process. We often think that seeing is simply the result of the information that our eyes are receiving from external stimuli in our environment, but it's more than just our vision. While seeing begins with our eyes, it also involves the way that our brain is perceiving that information that is being received through our eyes. And when our brain receives that information, it not only interprets it in relation to our expectations of what will be seen, but it also interprets it in relation to our other senses, our cognitive thoughts, and our memories. It's really a combination of these things. And when we become aware of what has been seen, so in other words, our brain learns how to perceive that information taken in through our eyes and through our other senses as well. Have you ever had that experience where you felt like your eyes were playing tricks on you? Vision and perception are not always entirely reliable, as many of us have had that experience at some point in our lives. Potential problems can occur not only when a person's vision, or with not only their vision, but a person can also experience those problems with their perception as well. In dementia, problems can occur in the brain as a result of the impact of the disease or the disorder that's creating that damage or atrophy in the brain. And because there's so many different stages or aspects to the seeing process, mistakes or combinations of mistakes can occur. And some of those common mistakes can include both misperceptions and misidentifications. Misperceptions occur when the person sees a particular thing as something else. For example, they might mistake a coat hanging on a coat rack as a person standing there. Or they might see a black mat on a floor and perceive it as a hole. Misidentifications can happen when there's damage to specific parts of the brain. And this damage can lead to problems in identifying specific objects or specific people. For example, a person with dementia might mistake a son for a husband or for a brother. Once we understand the impact of visual and perceptual problems that can happen in dementia, we become aware of how easy it is for the mistakes to lead to the person saying or doing things that don't really make sense to others. The difficulties that they're experiencing are not related to problems with their thinking. In other words, their mistakes are not based on incorrect reasoning or what's sometimes referred to as delusional thinking. The problem instead is a result of the damage that they're experiencing to their brain and their visual system. We're going to take a look at a couple of images here. So this slide shows two examples of misperception involving a coat rack. A person with dementia might interpret these images as a person standing there instead of a coat rack with those items hanging from it. And the shadows, especially in the image on the right, make the image appear more lifelike, more like a person lurking there. All right, let's take a look at the images on this slide. And can you see the difference right away? Look how easily it is, or easy it can be, for a person to misperceive this image of throw pillows and a blanket draped over that chair for a woman sitting in the chair. The floor lamp that kind of arcs into the image there can look very much like a person's head. And of course, the pillows and the blanket may look like the person's body. And this image shows an example of misidentification. So the man is standing at the sink in this image and he's looking into the mirror, and due to memory loss and difficulties with perception, he has the expectation that he's going to see himself at a much younger age. And in turn, he perceives himself or sees himself as a much younger version. So I'm going to hand things back to Shelby now to discuss the different parts of the brain and their role in vision and perception.
Thanks, Chris. So vision and perception primarily takes place in two areas of the brain, which we will take some time to explore now. So it is important to understand that damage to either of these two lobes can present significant change to how a person with dementia is able to experience their world. As some of you may know, the brain is made up of two hemispheres, the left side and the right side of the brain. There are several lobes of the brain that you can see here in the color image. Each differently colored area represents a specific lobe in the brain, and the area that is kind of a burgundy red at the top of the brain, or the crown of the head, is known as the parietal lobe. So we have a parietal lobe on both the left and the right side of our brains. The parietal lobe is responsible for several important functions. It is known as the logic and analytic center of the brain. And while it controls the functions that are listed up here on the slide, for the purpose of this presentation, we are going to focus on the areas related to perception and recognition. So we've highlighted these areas specifically on the slide. So of particular interest is the parietal lobe's ability to process spatial information, such as knowing where we are in a specific environment and where other objects are in relation to us. For example, the parietal lobe helps us to perceive how near or far we are to an object or a person, and where that object is in relation to other objects. If there is damage to the parietal lobe as a result of having dementia, the person's perception of this information may become distorted. The other main area the parietal lobe is responsible for that involves our perception of sensory information is our ability to recognize familiar objects and people. If this part of the brain is damaged, information that we take in through our five senses, so in this case through our vision, which we're focusing on today with this presentation, is often misperceived and misunderstood. So misperception of objects, we just saw with Chris, including people, can sometimes cause fearful behaviors to occur as a result. In this image, you can see the lobes of the brain that are highlighted in green at the very back of the brain. And this area of the brain is known as the occipital lobe. So the occipital lobe is our vision and depth perception control center of the brain. This lobe controls our vision overall and enables us to see and combine colors, shapes, angles, and movements into meaningful patterns. Damage to the occipital lobes eventually occurs in most types of dementia, although not generally during the early stages of dementia. Damage to these lobes usually occurs later in the disease process. Also, the surrounding visual areas that allow us to put the elements of vision together can be affected, which leads to unusual perceptual difficulties, such as a loss of depth vision or the inability to see movement. A person may experience difficulty figuring out what they see in front of them as a result of this. Loss of depth perception can have a significant impact on the person's confidence and their ability to move freely throughout their environment. It may change the way a person walks or the way that a person sits, for example. More severe problems with their visual perception can contribute to the occurrence of visual hallucinations, which we will talk about a little later in our session today. So with the changes in the brain that can happen in the parietal and the occipital lobes, which we just saw there, it is important to understand the impact that those visual and perceptual changes may have in three main areas: peripheral vision, depth perception, and color perception. So we're going to take some time to look at each of those now, and we'll start with peripheral vision. So with the loss of peripheral vision, a person with dementia may not be able to see people or objects unless they are right in front of them. This vision loss is often referred to as tunnel vision. So you may have heard of that term before. So with tunnel vision, the person experiences a loss of their side vision. This causes difficulty seeing people or objects around them. And individuals with dementia are more vulnerable to experiencing a startle response to those that may approach them from behind or from the side because they may not see them there. Loss of peripheral vision can impact the person's overall orientation, how they move around, and how well they can see at night as well. So let's take a look at some visuals that may show us this experience as well. So here we have two images that can give us a sense of what it might feel like to have a loss of peripheral vision. The image on the left depicts the visual perspective of losing the outer edges of our central vision and our side vision as well. And in this context, it's driving on the highway, so we know how important, that vision is for driving. The image of the long hallway on the right gives us a sense of what it might feel like to have a loss of peripheral vision. The picture gives us the feeling you get of walking down a narrow hallway where the hallway itself can feel like it's closing in on us. So that might be kind of the feeling that someone might experience with a loss of peripheral vision. So if you want to have a physical sense of what it's like to lose peripheral vision, you can kind of get a picture of it yourself if you make your hands into binoculars and hold them up to your eyes. So feel free to do that if you would like. But again, you can see how it's a lot harder to see those things, at the side, and it kind of creates that image that we're seeing, especially in that image there on the left-hand side. So that can kind of give you a bit of an experience of what that tunnel vision may be like. So looking at depth perception next, the loss in depth perception represents a loss of the ability to perceive distance in the visual field or to see in 3 dimensions. So a loss of depth perception also involves an inability to distinguish how far away an object or a person may be. With the changes in perception, a person may experience an inability to see over, under, or around things. And overall, everything in their environment may start to appear flat or two-dimensional, and things may appear to blend together. So you can imagine how difficult that might be. For example, it is hard for a person to distinguish where one thing stops and another thing starts. A transition from a tiled surface to a carpeted surface, where one step in a staircase starts and ends, where a white dinner plate is on a white tablecloth. These are all things that might be more difficult for the person to distinguish between because of these changes with depth perception. So again, let's take a look at some visual examples of this. So here we have some images of some different sets of stairs. The 2 on the top show pictures of staircases in particular. So the image on the top left gives us a sense of what it may look like to go up a set of stairs, especially if that staircase has a patterned surface. So you can imagine if a person with dementia who's experiencing some of these visual perceptual changes, they may have a hard time even kind of noticing that that is a staircase in general because of that pattern on the front of the stairs. The image on the top right shows what it might look like to go down a set of stairs where there's very little definition in the steps of the staircase. So again, the steps here may actually all blend together for someone who's experiencing these changes with depth perception, and they may have a hard time navigating how many stairs there are, where there's a platform for them to kind of get their footing on, and how to navigate that space. And you can also notice that there's no railing there either. So, that can especially be kind of unsettling for navigating. The image on the bottom shows what it might look like to try and navigate the stairs of an escalator. So if we think about an escalator, it's basically moving stairs, so that depth perception can kind of constantly be changing as we're getting on and then getting off that escalator. So moving stairs like these can be particularly difficult for people living with dementia. These images show us how different types and patterns and colors of flooring can cause significant challenges for the person living with dementia who's trying to navigate throughout an environment. So the image on the left shows dark flooring with white walls. So to a person with dementia who's experiencing this loss of depth perception, the dark flooring may appear as a large void, and they may avoid walking there for fear of falling through. The image on the right shows a black and white checkerboard pattern on the kitchen floor. So to a person with dementia experiencing that loss of depth vision, the black squares can appear as a series of holes in the flooring, and we may see that the person with dementia maybe avoids walking there, again, for fear that there might actually be a hole in the flooring there. So I'm going to pass it back over to Chris to look at color perception.
Yeah, thanks, Shelby. So a change in color perception could also make it difficult for the person with dementia to navigate their environment. Loss of color perception represents that inability to distinguish between certain shades of color. So the person might have trouble distinguishing between reds and greens, which is the most common misperception when it comes to color, or they may have difficulty distinguishing between blues and yellows, which can also happen, but is a little less common. Furthermore, color hues might not be as bright for the person, so they may not be seeing colors in the same vibrancy that somebody without dementia is seeing them in. Poor lighting or shadows can make that color perception and those difficulties with color perception worse. And loss of color perception can make things appear indistinct. So objects or surfaces might blend together with that lack of color definition. This slide shows a series of images that can help to depict what it might be like to have a loss of color perception. As you can see in all of these images, there's really little color definition. We often like to choose white dinner plates and white tablecloths for our dining experiences, for looks and aesthetics. But for the person living with dementia who's experiencing that loss of color perception, when you place a white colored food on a white dinner plate and you put it on top of a white table or a white tablecloth, that really makes the food look non-existent on the plate. It blends together, making for a very kind of unfortunate dining experience for the person with dementia. So for example, if we serve the person mashed potatoes on a white plate along with some broccoli, we might notice that they're eating the broccoli, but they leave the potatoes, even though broccoli may not be their favorite and they may really enjoy those mashed potatoes. And that could just be a result of the fact that they're not able to see the white potatoes on the white plate. In the past, many hospitals and long-term care homes have gone with the look of pristine white walls. And you can see that kind of image in the lower right-hand corner. So their floors and the ceilings in the buildings are all white. And it looks streamlined and it looks clean, but as you can see, it can make for a very difficult environment for the person with dementia to navigate. Again, the floors, the walls, and the ceilings are blending together, and with the high gloss kind of sheen on the floors and the bright lighting at the end of the hall, it makes it really difficult for the person with dementia to be able to see. It may look like that hallway doesn't have a beginning or an end. Bathtubs are another thing that can be particularly distressing for people living with dementia. So in the top right corner on the slide, you can see from in that image, clear water running into a white bathtub. And it really makes that bathtub look quite bottomless. You can't see, there's nothing providing definition there to show where the bottom of the tub is. And I don't know about you, but I know it would cause me a little bit of anxiety to step into something that really looks bottomless. You'd be quite worried about where your foot was going to land. Now that we've had a chance to talk about the parts of the brain that are responsible for vision and perception, as well as the types of dementia that cause vision difficulties to occur in these areas, let's talk a little bit more about the difficulties that may make vision and perception more difficult for somebody living with dementia. And the specific difficulties a person experiences really will depend on the type of dementia that they have. And this is because each type of dementia can damage the visual system in a different way. A person with dementia might experience a range of difficulties with their vision and perception. And let's take a look at what some of these difficulties could include. So they may be less sensitive to differences in contrast, such as black and white, and contrast between objects and the background. They may be less able to detect movement. They might have changes to their visual field, so how much they can see around the edge of their vision while they're looking straight ahead, which is known as their peripheral vision. So Shelby talked about this a little bit earlier, but this can be that cause of that tunnel vision that we kind of demonstrated. And also being able to detect different colors. So a person might have problems telling the difference between blue or purple, which can be problematic when we're giving directions. So if we say go to the blue door and they're only seeing a purple door, that could be a problem for someone living with dementia. Some other difficulties for the person with dementia could include changes in how their pupil reacts to light. They may get that blinded feeling a little bit more frequently because their pupil isn't dilating at the speed that it used to. They may have difficulties with changing or directing their gaze. They may have problems with recognition of objects, faces, and colors. They could lose the ability to say what has been seen. So if they're trying to describe something to you, they may have difficulty putting words to what it is that happened or the details of what they saw. They may have double vision, or they might have problems with that depth perception. So as Shelby was saying, the judging the distance of objects from themselves or navigating stairs. Dementia can also cause difficulties with orientation. So this could lead to the person bumping into things in their environment. So maybe they're bumping into a chair or accidentally knocking things off a shelf as they move past it. They think that they have more room than they do. They may swerve to avoid door frames, not being able to properly judge the position of their body as they're walking through transition points like a door frame or a doorway. Or they might have difficulties with reaching for things. So if they're leaning forward to pick up their cup of tea that's on the table, they may miss, or they may have difficulty reaching for a door handle to open the door. They may be unable to judge how far their hand needs to go.
Okay, so some other impacts on the person living with dementia that you may notice can also include difficulties with activities and hobbies, so reading and writing, for example, problems locating people or objects, even if they are in front of the person. So this may be because of other visual distractions, such as a patterned wallpaper, for example, or because of a lack of contrast. So for example, not seeing those mashed potatoes or that poached egg on that white plate, for example. We may also see the person misinterpreting reflections, such as seeing maybe an intruder or refusing to go into the bathroom because it looks as if someone is in there, when really they may not recognize their reflection in the mirror, and maybe they think that someone else is actually in there. We might see the person mistaking images on the television for real people or circumstances. So for example, if it is a show that involves maybe a war movie or fighting, they may feel that they are a part of or immersed in that actual event. So not being able to differentiate between what's on the TV and what's happening in the room. The person may have difficulty positioning themselves on a chair or on the toilet, for example. So they may sit on the arm of the chair instead of in the actual seat of the chair. And we may see the person becoming confused or restless because the environment is visually overstimulating and it is difficult for them to navigate. So for example, a room with patterned wallpaper, a busy carpet pattern, bright lights, or too many signs may be overwhelming for the person because their brain has to try to process too many stimuli all at once. So here we have a few more examples of some of the things that we just talked about. So as this image shows, a person with dementia may think that they are much younger in age, and when they look in the mirror, they are surprised to see an older person staring back at them. So they may think that this person is maybe an intruder or someone that follows them around because they don't recognize that they are much older than their perception of themselves. So this picture is as festive as it looks. It is a perfect example of how busy and overstimulating environments can be difficult and distressing for a person with dementia. So here we have the bright lights, the busy Christmas decor, the reflection of the Christmas lights there on the glossy floor beside the tree, the busy and patterned area rugs, the wreath around the chandelier, and other Christmas decorations can be found all throughout the room, and all of this put together can appear to be very overwhelming for a person living with dementia. And if we break it down a bit more and look specifically at those busy area rugs that we saw in the room there, let's take a good look at these carpet images. So can you see anything within these carpet patterns? So if you take a moment there and look, we may see a face or an object or perhaps an animal. So in these two examples, some people may see a face, or maybe they see an animal face, or the eyes or ears of an owl, or a bird shape, or even something scarier. The left image looks like it could be a fire-breathing dragon, for example. So again, imagine how distressing or overstimulating busy carpet patterns could be for the person with dementia who's experiencing perceptual difficulties. And unfortunately, these patterns make me think of almost any hotel. They seem to really enjoy patterned carpets and furniture. So again, these might be things that are more difficult for the person with dementia to perceive correctly. Visual and perceptual difficulties can also lead to problems moving around and navigating the environment. So as a result of these difficulties, people with dementia may experience difficulty in these areas. So they may misjudge the distances and the location of certain objects, even in a familiar environment. They may step too highly over carpet transitions on the floor or over shadows because the change in color looks like a change in level or height for them. They may have difficulty going downstairs due to problems judging how many steps there are and where the next one is. And they may also try to avoid shiny floors and surfaces because they may appear wet or slippery to the person with dementia. So these problems can make a person afraid of falling and may lead to them slowing down their movements while they try to walk safely over these types of surfaces. So again, let's look at some examples here. So this slide shows images of how a person with dementia may have difficulty in various environments here. So the two images at the top of the slide show how the physical space may present barriers to the person moving about freely. The image with the shiny floor is very difficult for the person to perceive. The reflection of the kitchen window in the floor may be quite confusing and unsettling. So the person with dementia may avoid walking on this surface because it's so shiny, that it appears to be almost wet. Similarly, the image with the long shadows that are being cast over the hardwood floor may appear confusing to the person with dementia. So they may not understand that the pattern on the floor is caused by a series of shadows, and they may try to step over that shadowed area, or they may avoid entering that space altogether because they're unsure of how to navigate that. So shadows can be tricky sometimes for people living with dementia. The two images at the bottom of the slide show how difficult it can be for a person with dementia to judge the distance of objects in their surroundings or in other words, how close or within reach the object is to them. So as you can see, one image shows a care provider handing a cup of tea to a person, ensuring that they can grasp it and hold onto it. The other image shows what can happen when a cup of coffee has been placed on the table for the person to enjoy, and they've misjudged either the distance of the table, bumping into it and spilling the coffee, or not being able to judge how far away, that saucer is from them. When they go to get that cup of coffee, they may, hit the cup and spill that coffee. And again, going back to that color contrast, we want to remember here too, it could be difficult to judge the distance when trying to reach for or set down a white cup in a white saucer on a white table as well. So again, it can all blend together when depth and color perception are both being compromised by those changes related to dementia. So now let's look at some tips and strategies for supporting a person with dementia with these changes and with their movement and orientation. So some suggestions here include trying to anticipate the situation and explaining the environment. So for example, if you notice that the person with dementia is avoiding a room with a shiny floor or surface, for example, you could walk in first to show the person that it is safe. If they are reluctant to enter their darkened bedroom, you could walk in and turn on the lights and explain that you're going to make sure there is enough light for the person to feel comfortable. So again, trying to support them in that environment and reassure them is helpful. So providing that support and encouragement, recognizing that even just having this understanding that these are some of the things they may be experiencing, can help us provide that reassurance. And a really important tip is to try not to make the person feel rushed and to allow them plenty of time. So this can help them to feel more comfortable as they navigate through that environment. And another way to do this is to slow down your own movements. So this will help them to follow along in a safe manner and for them to not feel like you are rushing and they need to keep up with you as you move through that environment. If a person with dementia is living at home with other people, it may not be clear how their visual difficulties affect them until they experience a change in environment. So this may include visiting family or going out shopping or going on a holiday. So maybe when they're in an environment that's different than kind of their normal environment, you might start to notice some of these changes that you aren't noticing as much at home. So the other thing that we want to keep in mind is that we can't forget about other visual considerations for the person living with dementia as well. So it is important to take into account the following questions to help the person with dementia to see as well as possible. So first, if they wear prescription eyeglasses, we want to ask, are they the right prescription? And can the person see, as best as possible through those? Are their eyeglasses clean? So sometimes, part of the issue might be that those glasses need to be cleaned regularly. Are those glasses easily accessible and are they left in plain view? So, we know sometimes there might be challenges with dementia with getting someone to maybe wear their hearing aids or wear their glasses so that we can make sure that they're seeing or hearing as well as possible. But if we can make sure they're accessible, make sure they're in plain view, have something that they can attach them around their neck, for example, those things might help. And also considering what other visual impairments could they have. So going back to the very start of this presentation, when we looked at different conditions that could possibly be affecting the eye, in addition to some of these visual and perceptual changes with dementia, making sure that we are getting those checked out if we think there might be something contributing to vision changes there is also important. So we mentioned we are also going to touch on hallucinations later in the presentation. So I'll turn it over to Chris now to cover that.
Great. Thank you, Shelby. Yeah, so delusions and hallucinations can often be symptoms of Alzheimer's disease and other dementias. In specific forms of dementia, hallucinations are more common. So these include Lewy body dementia and Parkinson's disease dementia. With delusions or hallucinations, people do not experience things as they really are. So let's discuss why delusions and hallucinations happen in dementia, and we'll explore some tips for coping with them. So a hallucination is an incorrect perception of an object or an event involving the senses. In other words, the person is experiencing something that's not really there. They seem really real to the person who's experiencing them, but they can't be verified by anybody else. Hallucinations are a false perception that can result in either positive or negative experiences. Hallucinations experienced by people with dementia can involve any of the senses, but are most often either visual, so seeing something that isn't really there, or auditory, hearing noises or voices that don't actually exist. Sometimes hallucinations can involve smelling, tasting, or feeling things that don't really exist, but those types of hallucinations occur less frequently than the visual ones. An example of a visual hallucination could be seeing bugs crawling over a bed or over a wall that aren't really there. And of course, as we already mentioned, people can make visual mistakes. So mistaking a house coat hanging up for a person, for example, because they can't see that object clearly. And that can happen to anyone, and it's not considered a hallucination. So let's review some of those possible causes of hallucinations. The first one is different combinations of medications. That can sometimes cause a hallucination. And if that's the case, you really might want to speak to a doctor about it. Unfamiliar people and unfamiliar environments is another possible cause. A change in routine can affect the person and bring about hallucinations. Inadequate lighting, so not being able to see the environment clearly, can bring on a hallucination. Overstimulation in the environment, so too much noise, too many people, too many distractions going on, that can bring on hallucinations. And late day restlessness, which we also sometimes refer to as sundowning, is a form of disorientation and confusion that some people living with dementia experience in the late afternoon. And during those times, the person is more prone to having those hallucinations. Delusions are false beliefs. So despite our best attempts to reason or to provide evidence about something to the person with dementia who's experiencing delusions, they won't change their belief. For example, a person with dementia might have a delusion where they believe that someone else is living in their house with them when the person actually lives alone. Delusions can also be experienced in the form of paranoid beliefs or in accusing other people for things that haven't happened. So an example here, the person with dementia might misplace an item and then blame others for stealing it. Or if a care partner leaves to attend an appointment outside of the home, the person with dementia might accuse them of having an affair because they've left the house. Some people with dementia may have the delusion that others are out to get them. Or, for an example here, the person might believe that somebody's trying to poison them or that their food is being poisoned. So these are some different examples of delusions that can occur. So how might we respond? Hallucinations and delusions can be particularly distressing, not only for the person living with dementia, but also for their care partners, for family members supporting the person. And here's some suggestions for responding to hallucinations and delusions when they happen. The first is to try to determine if the person is experiencing any difficulty with their hearing or vision. So let's narrow down what could be causing these hallucinations or delusions by supporting the person to make sure that they're using their hearing devices or their vision or their glasses. Make sure that the lighting in the room is adequate. I know we've talked a lot about lighting, but having good lighting, it really can help stem a lot of the things that we've talked about today. Making sure that the person is eating a well-balanced diet, because malnutrition and dehydration can sometimes result in an undernourishment of the brain, which can cause these hallucinations or delusions. Trying to make the environment as comfortable as possible. Unfamiliar people or unfamiliar environments might be disruptive or stressful for the person living with dementia. Keeping routines and schedules as consistent as possible can help in response to hallucinations and delusions. And trying not to change the person's environment. So that's another piece when we talk about consistency. And checking for signs of physical injuries, such as bruises or scrapes, maybe a fall that wasn't witnessed. If the person fell and maybe had a bump to their head, that could cause a hallucination. So making sure that we're checking the person's physical self as well. Determining whether the hallucination or the delusion is bothering the person with dementia. So if the person is having a hallucination where they're seeing bunnies in the yard and the person's laughing, they enjoy the bunny, watching the bunnies play, well, then in that case, we might not need to address it with them. We may just want to validate their experience, and say something like, yeah, I really like bunnies are super cute. I really enjoy them too. Trying to find ways to alleviate the distress. So if the person with dementia says that their necklace has been stolen, if that's a delusion that they're having, you can offer to help look for it with the person, or you can try and distract the person with another activity. Thirdly, let's respond to the person's feelings and not to the issue. So rather than contradict the person and tell them that their hallucination or their delusion isn't real, instead we want to acknowledge their concern and their emotions. So again, we're validating what's happening for them. We don't want to get angry with the person and we want to avoid arguing with them. You are not going to win an argument with a person that's having a hallucination or a delusion, because let's remember that hallucination, that delusion is very real to the person that's experiencing it. We also want to investigate suspicions that might be based on fact. So it's possible that the person really could be a victim. Maybe somebody did take something of theirs. So we do want to look into any concerns that they're bringing up. We want to use familiar distractions. So if the person is feeling upset, then possibly we can kind of change what's happening for them by turning on some music that they really enjoy, making sure that they're getting enough activity and exercise in their day, getting out the cards, having a game of cards, or even looking at pictures together. And finally here, offering those gentle reassurances. So if the person is experiencing a hallucination and they are fearful, they are having anxiety, letting them know even just that you're there with them could be helpful. So for further information about some of the things that we've talked about today, there's a few different resources on the screen here, some different websites, and we can post these in the chat after the presentation. And as we come to the end of our presentation today, I just wanted to share some information about our local Alzheimer's Society. So we truly understand that living with and supporting somebody with dementia isn't easy, and we want you to know that you're not alone and the Alzheimer's Society is here to help. So we have a range of different supportive services that are designed to assist you in your journey. And on the slide up in the top right corner, you can see a picture of our intake coordinator, Maddie. She is your first point of contact with the Alzheimer's Society of Peterborough, Kawartha Lakes, Northumberland, and Haliburton. And Maddie's job is to connect you with the right person, the right resources to meet your needs. Gifts from donors really allow us to provide the programs, care, and support to people living with dementia, along with their care partners right here locally in our communities. And we wanted to take this opportunity, take a moment to acknowledge all of their important contributions and to say thank you. So thank you to our donors. And lastly, thanks to you for taking the time to join us today. And at this time, we're going to stop sharing the PowerPoint screen and we're going to open the floor up to some questions.
I'll just stop the recording.